Dr. Jaffe, I know we talked about prenatal care, but how about postpartum care? Which supplements are recommended?
Very good question. To some extent, we have to start in the kitchen and then get on to what supplements at a minimum are necessary. Baby gets first, mom gets second. So assuming you're a nursing mother, the baby's saliva tells the breast, areolar tissue, what the baby needs. The breast milk changes in terms of its fat, mineral, amino acid composition. It's an amazing biosensor. So if you're eating foods that you can digest, assimilate, and eliminate, if you have a transit time of 12 to 18 hours, if you're well hydrated, then other things work better. At a minimum, you want to keep your urine sunshine yellow. So usually that means a slight increase in the amount of PERC Lifeguard capsules that you would take. You do the C-cleanse, if possible, weekly, and as soon after birth as possible, because, no surprise, birth is a stress. The pelvis has to open, a whole lot of rather remarkable things happen in a fairly short period of time. And that tissue needs to repair. So that means keeping your immune defense and repair system in repair mode. In theory, that means having ample time to think an adult thought, having ample time to get restorative sleep, having ample time to stretch and move, at least 45 minutes a day. Recognizing that these are suggestions, these are not rigid, and different women recover quite differently. If a woman is properly prepared, birth is a very intense, but not that painful experience. Most women are not prepared. What else in the postpartum period? Well, we know today how important magnesium is for so many different things. So checking morning urine pH and having doses of PERC, Mag Plus Guard, and choline citrate in proportion to that first morning urine pH. We know how important omega-3 is. 1/3 of anyone's brain, but especially a baby whose brain is growing, 1/3 is DHA. And while ascorbate is also got a form called DHA, we're talking here about the omega-3, EPA, DHA, and you need both. You need EPA for body and brain, you need DHA for brain and body, you need both. You can't just take DHA from algae or purified EPA for various reasons. Assume the body has just been through intense stress and therefore it is not, it's used up some of its reserves. So you want to rebuild resilience. To me, that would mean 6 to 9 grams, 6 to 9 grams a day of PERC EPA DHA guard. I guess I haven't mentioned Repair Guard, and I should, because by the handful, if a mom can, she should take Repair Guard to keep boosting that first repair part of the immune system's responsibilities. I think that either hair, skin, and nails or bone guard is elective. I would not put it on the priority list. Everything I've said up until now, I would consider priority supplements. If a mom has postpartum mood issues, sometimes mistakenly called postpartum depression, it means she's run out of antioxidants and buffering minerals and neurochemicals that, while they come from amino acids, they have to be processed by enzyme catalysts that depend upon magnesium and ascorbate and all of the things we're talking about. Now let's see, what have I maybe, yes, so if you have postpartum mood issues, then the carnitine, the MDP guard, becomes very important because it means that something has probably shifted fat-soluble toxicants from your fat pads into your cell battery called the mitochondria. And it's hard to be optimistic and loving and so forth when your neurochemicals are not forming properly, or more possibly when they're being damaged, oxidized. because of a lack of ascorbate and other antioxidants. You can get your carotenoids from fresh, colorful fruits and vegetables, or you can get your carotenoids, but it should be not just the beta carotene, it should be all the carotenoids, because it is a team. And each of all the forms of all the nutrients that we recommend have very specialized places in the body where they are most effective. For example, the gamma form of vitamin E is heart protective. And very often doctors say to mothers postpartum, don't take supplements, it might affect the breast milk. And I've already said, and I will say in conclusion, that breastfeeding is wonderful for both mom and baby, and the breast is a most remarkable biosensor. Nothing we have invented in engineering comes close to how elegantly simple and simply elegant the breast is and protects the baby. So yes, in most industrialized people, in their fat and in their blood to some extent when they're under stress, these xenotoxins, these environmental toxins, these hormone disruptors, these persisting pollutants, these solvent residues, toxic metals, mold products, radioisotopes, electromagnetic radiation. All of those are anti-nutrients. So all of those, quote, up the need, at least in the 21st century, if you want to be a healthy mom with a thriving, healthy baby. If I say that in a slightly different way, most women are marginally malnourished from a nutritional point of view, even if they have what's called a doula. A doula is generally an experienced woman, sometimes a nurse, but someone who basically takes over the care of the house for a month so that mom and baby can bond, or mom and family can bond. If you have access to that, I think that is an excellent choice. We were able to do that, and I think it made quite a big difference. So there, your question was very targeted. What supplements in the postpartum period? I tried to address that, but address that in the context of what does the alkaline whey mean for a mom who's just had the gift of a baby.